3.
Hey, Cameron.
Right.
Dr. Rob, it's great to see you again.
Great to see you again.
First off, I wanted to say thank you for coming in and bringing your wife. One of the things that we see here that's excellent is whenever a husband and wife team both come in. I know the group report of findings, the group doctor's report that y'all both went to, is probably a little different than most medical doctors you've been to. But one of the reasons we do that is initially the information is the same for everybody. We really like to cover the basics of how the body works, of how a subluxation can really start taking people's health away from them. And it's awesome to see people so committed, because we're extremely committed to our patients here. And it's awesome whenever a husband and wife team can come in. It really shows that they're committed to getting things better. And now that your wife's in the waiting room, we have a time to answer any questions that you have. We like to keep it confidential that way. So I have looked at all your patient history. I've got your x-rays that I'll pull up in just a second. But we want to make sure that any questions or concerns you have, we really take the time to answer those. Does that make sense? Okay, awesome. So I have had a chance to look at your x-rays. I'll get those pulled up right here. So what we're seeing, first off, I know the main question most people have is, can we help? And from what I'm seeing here, I have a lot of confidence that we can help you. I've handled a lot of cases just like this, and chiropractic works wonders in cases just like yours. So whenever we were in the group report of findings and we were explaining how the spine has to have a curvature here, this is what we're looking at. So if you see this x-ray right here, this is looking just straight onto a patient, so just front to back. This next x-ray is looking from the side view. So on the very first front to back view, it should be nice and straight. So the one on the left is actually a textbook normal x-ray. And what we're seeing with yours right here on the right is a little bit of a loss of that curve. So whenever that happens, the spinal cord's actually going to be getting stretched, getting twisted a little bit, and it's interfering with the nervous system control of the body. From the side view on yours, we're actually seeing pretty much no curve at all. So that's definitely something we want to address and start building your care plan in order to start moving you back towards that proper alignment. Does that make sense? Okay. So the problem, like I said, I know you're having some pain and some tingling, some numbness occasionally, and a lot of those nerve roots that go, down the back of your leg, what you were talking about, actually start right here. It's called the lumbar spine. It's just the lower part of your back. And what we're seeing with yours, especially if you see right here, that's what a lot of people would call arthritis or osteoarthritis. It's another way of saying a degenerative joint disease. The good news is that yours is not too bad yet. This would probably be about a grade 1. We start seeing the body laying down a little bit more calcium here. And basically what that's doing is, since the spinal cord is so delicate and so precious, the body tries to protect it at all costs. So it's good. You don't have anything fused yet. This would be a case that I think we could definitely get you some relief of your symptoms and problems. But of course, everybody's different. So the treatment is that we like to do chiropractic adjustments. We're going to start restoring proper motion to that. And a lot of times we'll actually see a patient's symptom will start going away very quickly. For you, I think we should start a trial of care, being about 3 patient visits per week. And we'll try that for about 4 weeks. So it'd be a total of 12 adjustments. That'll give us a time to really see how well things are working, and really give us a time to see how quickly you're progressing. After those 12, we'd reassess, and then we can see if we can maybe move you down to 2 times a week, maybe 1 time a week, depending how things are going. Does that make sense?
Yeah.
So we charge $40 for every adjustment, and with yours being 12, it'd be $480. We can collect that either all up front, or we could collect it every time you come in, just however you want to work that out. We don't have to discuss that now. So that really covers everything. The overall health and wellness, what we do here. I brought this for you, and I want you and your wife to go through this whenever you get back tonight. Because this is just a really good explanation of a lot of the organs in your body. Like I know you were saying you were having some intimate problems with your wife, and that's actually very common, especially when we're seeing problems in the lower spine like this. The same nerves that can just create that tingling, that can create numbness, are ultimately going to go to some of those very organs, like reproductive organs. It can also go to digestive, heart, lungs, various things like that. And with chiropractic adjustments, we've really seen a lot of improvement in those areas too. So I am very optimistic about your case. I also want y'all to go through tonight is this section right here. One of the reasons I feel we get amazing results in our clinic is we really don't stop at just adjusting people. We want to really give you the tools to back that up. So a lot of times people know they need to eat better, but they don't necessarily know how. We go through workshops here in our office. They're usually about once every month, once every 2 months. We really touch on nutrition as well. We help people with exercise. Again, people know they need to, but they don't think they have the time, they don't know how. And especially in your case, you want to do it safely. You don't want to hurt yourself more. So that's something we can really help with. I want you and your wife to go through this tonight, and just any questions you have. Your first adjustment will be tomorrow, so you can bring that up at any time. Do you have any questions at this point?
Not really. It's just my whole thing is being a stay-at-home dad. It's hard to find the time to really, work out or get in here. Is there any way I can set my own schedule, or is it I have to follow the same schedule every time I come in?
Yep. So great question. I'm actually glad you asked that. We have open adjusting hours here, which means as long as you're making the recommended times per week, we don't care at all what hour you come in. So twice a week we're open as early as 6 a.m. to accommodate patients that work, or patients that you have 3 kids. That I can only imagine. And then twice a week we're also open up until 7 p.m. as well. So as long as you're coming in and making your adjustments, we'll never have any problems with you scheduling an appointment. You can come in at any time that we're open. So other than that, we'll go ahead and get you set up, pay Cindy up front, and we'll get you set for the first appointment. Will be Monday.
All right.
Sound good?
Yes.
All right.
Thank you very much.
Thank you.